Maybe that will help. Okay. So let's find the acromion. You guys know that, we find the spine of the scapula first, right? And here is the acromion. This would be the posterior border of the acromion, anterior border of the acromion, and this is the lateral border of the acromion. So just below it, that would be where your subacromial space is. And this is space that is very important clinically, because this is where we find a bursa, and we also find the tendons of the supraspinatus. So it's a place where there is a lot of impingement syndromes and a lot of shoulder problems in people that work overhead, performing overhead activities. They develop that type of shoulder pain because there is a lot of compression and impingement in this area. Anyway, that would be the subacromial space. Then just below that, that will be where you will find, it's muscular, so it's a little bit difficult to palpate, but this is where you're gonna find the greater tubercle, okay? So it's just on the side, so it would be, in this area over here, okay? And then let's find now what's next in the list. Lesser tubercle. So to find the lesser tubercle, the way that you can do that is find the coracoid process. So to find the coracoid process, find the lateral border of the clavicle, drop down a little bit, and here it is. Okay. Okay. Coracoid process is there. From there, you just move laterally a little bit, hold the arm here, and you're gonna feel the joint line and then a first bump over here. So that's what I think it is. So in order to confirm, you can just rotate medially and laterally without moving your finger. When you do that, what you're gonna feel is that bump rolling underneath your finger, which it is rolling in this case. So that would be the lesser tubercle.
And you do passive movement?
It's passive. He's not doing it. Okay. You're doing it for your partner in this case. So that would be, the lesser tubercle right there. Okay, this greater tubercle is a little wider than this. And then in between, to find the intertubercular groove, I just know that once I find the lesser tubercle, which is there, I just move a little bit more laterally, and that's where the bicipital groove should be, or the intertubercular groove, which I feel relaxed, a little bump on this side and a little bump on the other side, okay? So that's where your intertubercular groove is located. What is next?
I think that's it.
Okay.
What about the one right here on the side?
Oh, yes, the deltoid tuberosity. We need to find it, but here, for example, the deltoid tuberosity is more like a landmark rather than a bump. You're not gonna feel something like that. So to make sure that you know where it is located, essentially you just have to look at the length of the arm or the humerus and split it in two. A midpoint, kind of over here, that's where your deltoid tuberosity should be. If you want to be very specific, you can just ask for contraction of the muscle, the deltoid, push into my hand, out, and follow the muscle until the point where it inserts in the humerus, which is kind of right here. That would be the deltoid tuberosity, okay? It's on the lateral side of the arm. Then you also have the spinous processes, right? Do you mind taking off your shirt? And maybe facing the other way?
Yeah. Just stand or?
Yes, can you sit down over here, please? So we need to find for C7. In C7, we can ask our partner just to bend their head forward, and that's at the base of the neck. So the vertebra or the spinous process that is the most prominent, that would be your C7, okay? So let's mark it over here as C7. And I can easily count up C7. I feel a space. Oh, another bony prominence. That must be C6, right? Then another space and another bony prominence. Oh, that must be C5. Another space and another bony prominence. That must be C3. Or was it C4? C4. C3. And this is the last that I feel, the C2. C1, I shouldn't feel anything because C1 doesn't, which is the atlas, doesn't have a spinous process, okay? Now, for the spinous process of the thoracic vertebra, it's easier if you ask them to bend forward. Can you bend forward your thoracic spine? Yeah, just like that. So we can feel these bumps over here. So this would be your C7, right? Then space and bump, that would be your T1. Space, and this is T2. Space, and this is T3. Space, and this is T4. Space, and this is T5. Space, and this is T6. Space, and this is T7. I'm gonna stop right there because, can you sit up again? Normally, the inferior angle of the scapula here is at the same level of T7. So sometimes if you're with a patient and they tell you that they have kind of pain in this area, and you don't, you can just easily find the inferior angle of the scapula, move across, and that's most likely T7, okay? Or you can easily find C7 and count down, just as you can find C7 and count up. The other option is finding the first spinous process here, and that would be your C2, and you say C3, C4, C5, C6, C7, right? Any questions? Okay, so that's all for right now.